Hi, my name is Yolanda. I'm a multiple myeloma survivor. I was diagnosed in 2008. I'm a entrepreneur. I've been that way since forever. So I've published, produced a few newsletters. Um, I love to write, so I do a lot of writing in the blood cancer community, um, as well as fitness. Um, I like to exercise because I feel that's part of my journey, of this new health journey. Um, and I like to cook, and be around my friends and family and travel. Prior to the diagnosis, I didn't know there weren't really any call outs. Um, like as I shared my story, I worked in the fashion industry. The job that I had was very stressful. So stress tends to do things. So in terms of was it a call out that there was blood cancer? No, not really. Wasn't thinking that. But just highly stressed. There were two things that I did notice. I had a high urge for starch, to eat starch. And I know my anemia was also like a call out. Um, and then my bones would click. Like if I walk up the steps, my knees, it was like this weird clicking noise. Those were the two call outs. And in the starch, it was like white rice cold. It was very weird. And I don't eat rice like that. So I was like, okay, well, what's that about? So yeah, there were no prior call outs except those two and just being highly stressed based on the profession that I was in. Despite the diagnosis, I think I'm very lucky because I have always been a person to go to the doctor's appointments, make sure everything is checked. You did this, you did that, you did this. So this was a routine once a year primary care. Take your blood work, maybe some urine, depending on whatever the doctor, wants. And that's kind of what it was. At that time, I was stressed. Okay, go to the doctor. Okay, do the blood work. He was good that he would call you with the results, whether it was good or bad. And it usually was good. So I didn't think much of it. When he called, however, he said, yeah, your protein levels are high. So he didn't really, it's so long ago, I don't remember the specifics, but it was basically you have to see a specialist. And I suggest you seek a hematologist. So I was like, okay. Now, as I tell the story, it's comical, to some degree. But my husband and I, we were planning for a trip to Mexico. So that's kind of what was on my mind. Like, okay, I did this doctor's appointment. This job is driving me crazy. I'm trying to get on this plane. However, so I had about a 2 weeks, leadway to the trip. So he called the following week. So this is two calls now. And he was like, did you find a hematologist? And I was like, no. He said, this is serious though. I chose a hematologist who was close to my office at the time. And yeah, that was an experience. So I walk in, um, everyone in there is of a certain age, and they weren't close to my age. So we're looking at people in their 70s, 80s. It wouldn't shock me if in the 90s. Okay, they were up there. So the receptionist, everybody is looking at me. he said, well, you have multiple, it seems like you may have multiple myeloma. I think there were a few visits in between there, and he gave a bone marrow biopsy. So that was my first experience with a bone marrow biopsy. He didn't do it properly because with multiple myeloma, usually they want an aspiration. He only did one of the two. So when I did get a second opinion, they had to do it again. Okay. So those are things you live and learn. You're not gonna, I guess, know off the bat. We did a second opinion. I found a doctor at the Mayo Clinic, and he was like, "Oh, okay, you have smoldering myeloma." So it's kind of, I guess you could say, asymptomatic, like something is going on, but it's not active. So you don't really need to do treatment right now. So that kind of led into seeking another doctor because we weren't going all the way to the Mayo Clinic from where I was at. And then that's a whole conversation with the insurance, who covered it. It's just, that's like a whole thing. So we were like, okay, so he was nice to give his listing of colleagues in the New York area because that's kind of where I was at. And that's how I chose the doctor that I continue to use now. The difference between, I can say, first it was a primary care, then it was a hematologist, then it was a multiple myeloma oncologist. There is a difference. Okay. So that's how my journey has been. But no one showed me the ropes. It's just like you learn along the way. It's scary because I think in the beginning, you know, as a lot of people, you have that wave of emotions of, what are you telling me? And then not only that, you're telling me this word multiple myeloma, but you're not really saying it's cancer. You know what I'm saying? It's just like a whole thing going on. So in the beginning, initially, I think a lot of people will be scared, and just go with whatever the doctor is saying. But there were too many red flags with this individual. Okay. And that allowed me to open up to, like I said, it was like another party as to, oh, well, maybe seeking someone else, and that kind of just led into, the Mayo situation. Just to ask questions, because I know it's so simple to say, because you get into a fog of how did I get here. So that initially is not going to be your thought of, oh, well, you're this kind of doctor, I need that kind of doctor. A lot of people really don't know. You just have to, somewhere, maybe in the beginning, after that initial phase, maybe something will pop where, oh, okay, well, I need another specialist who can take care of me here. But it's a huge difference because this person knows your disease from A to Z. Not to say a hematologist doesn't. Like, I really don't know exactly. They're kind of the same, but they're not. They really aren't. So, though the hematologist brought up the term multiple myeloma, like, oh, okay, my God, what is this? Blah, blah, blah. The specialist broke it down in terms of what it is. He gave a little bit more juice to the story of exactly what it is that I have to battle. When we think of cancer, or most of us, we think of infusions. Okay, it's sitting up in the chair with the needle sticking out of you with the infusion bag. So if you're saying that, oh, we're going to watch and wait, to me, I was like, okay, that means my life doesn't change. That's what it meant. Like, okay, whatever's happening in my body, Okay, it's not activated yet, if you will. You know, you feel like it's a Duracell battery. So it's like it's at bay. Okay, until you need a new battery in you. It literally was 5 years. So I had a 5 year run. But the body does stuff. So despite this is at bay, I had another health hiccup that actually activated the multiple myeloma. So what was smoldering now became active multiple myeloma. So yeah, but with that said, the watch and wait, I was cool with it. I still felt like it was a burden. Oh, the doctor still wanted me to get my labs done, to see if things are still at bay. So when I think about it now, I was like, oh, I got to go over here to this clinic thing before I go to the office. All of these things that, hello, girl, like, this is some serious business. I think for me, it was the whole probability. I think a lot of people quickly, understood the whole Google land, okay, of looking at what is your disease. Let's say if the doctor is not explaining it the way that's layman term, you doing, being a little bit more inquisitive. I can be quite inquisitive. So it tells you straight off the bat, 5 years you're dead. So we use those terminology. Then right away I'm thinking, okay, it's 5 year watch and wait. Okay, which I'm lucky because it depends how long your watch and wait can be. And then you're telling me, okay, treatment and then death. Like it just didn't make any sense. You're telling me a number, then you're telling me what that number could possibly be. So it was just a whole mixed bag of emotions in terms of what is it these people are telling me, you know. So yeah, in the beginning it was a little rocky. Um, like I said, finding the right doctor, which I don't know if that was a fluke or that was just, where the advocacy really comes into play. Like, this doesn't sound right. So let's kind of go over here and find somebody who can explain it properly. There was like my chest sternum was protruding. So that was an inkling of myeloma. So though there was the watch and wait, and I always tend to forget there was radiation treatment for that. So it was like a strange thing in the middle of my chest, like just poking out like the bone or something. So that yeah, that was a remnant of multiple myeloma for me in my case. So we did radiation treatment. It was just a few rounds of that. I don't remember. And then it continued as the watch and wait for 5 years. So when we actually had to start, I guess, targeted therapy, that was interesting. Um, because again, that word burden comes back into play. So, okay, oh, now I have to actually take medicine. How is my body going to react? And that's always the trial and error for a lot of patients. You just don't know. And even the doctors don't know. That's kind of where it freaks you out. You have to take it to see what's going to happen. So mine's consisted of some pills and a needle, okay, which was the subcutaneous section. Okay, so this was at my stomach, just to be specific. It was a mess. I was not happy at all. Like the pills, I was like, okay, let's do the pills. But part of me feels like the pills were a little interesting, where that needle, like they all work together, but I feel like maybe some of the pills did more a little damage in terms of side effects than the actual um, needle. So that was interesting. However, this lasted for a few years and my numbers were going down. So that made me happy. That made my doctor, he was very happy. But then he wanted to up the ante. Because again, everybody was looking at you're young. Okay. So we want you, it was a new drug at the time that came out. Which I have to say, I'm so happy of the options that we have now, because back when I was diagnosed, it was just a couple, and like I said, just a couple, you know. So this was a new drug at the time. However, taking the drug was different from my little two pills and the shot in the stomach. Now you're talking about infusion, and it's learning these terminology. Okay, what's the difference between the shot and at the subcutaneous section of your body versus an infusion? Oh, an infusion is what I dreaded. Okay, now you're telling me I have to sit in this chair, with the needle, in the bottle, and okay, that's what an infusion means. So again, it's just getting your mind around the terminology and now what is changing from what you were familiar with for 2 years or so. Now this other thing. However, I have to say that brought me into complete remission. So the numbers were going down. This drug, despite the fact it was a lot, I have to say, not to say like the first batch wasn't a bit much going on, but this one was more so because they hydrate like your heart has to be saturated, if that makes sense, before you actually start the actual treatment. So that was a lot. And this wasn't like a quick in and out. Like the first was a process, you being there like a little bit, but not too. This one was like, okay, give or take, you're gonna be in here a good 2 to 3 hours. For the last good many years now, I've been in complete remission. I've been zero spike. And this is stuff that I do tell other patients that I do speak with. It depends on what doctor you have. So having a multiple myeloma oncologist, and there's like different, I guess, studies and different things that each doctor may use to treat the patient. But I do tell patients that it's important to try and understand the terminology, really understanding the reason of why they're doing it. So if it comes back negative MRD, that's what we want to see, which is minimal residual of the disease, versus just doing it, and that's where, again, depending on the doctor that you have, to educate the patient exactly what is that and why it's important based on your situation. I just got clearance not that long ago that still in remission, and now I don't really have to see you. Oh, well, he still wants to see me once a year, which is good because we were doing once a year for the last stretch that I had. But I don't have to do a bone marrow biopsy next year. That's a party right there. Okay, because for the last, oh my gosh, I feel like it's a decade. It's over a decade that my whole myeloma journey has started. Anxiety, I think, will always be there until I leave this earth. So I think a lot of blood cancer survivors, specifically multiple myeloma, we always have that monkey on our back, if you will, okay? Because the space that I'm in when I speak to other vocal advocates is like, you just don't know. Like a lot of people have had nice little stretches and then the disease kicks back up. So, knowing that and understanding how the disease works to some degree, it can be trying in terms of when, where, what, and how. However, as I always say and will continue to say, I live in the moment. So right now I'm in remission another year. Okay. I'm a I'm a soak and absorb that, you know. If things happen in the future, then we will address that as we need. Um, I'm so happy to still be here because I don't know how my story would have gone if I started treatment earlier than I needed, and especially with the drug that was suggested at the time. So I'm happy to be here, okay, sharing and doing, but it's still there. The anxiety is there. And again, as I said before, the body still does what it does because now I have like another chronic thing going on. Okay, so I tell people and also stress this on myself. Um, there's no going back to what your life was prior to being diagnosed. You know, it really isn't. Um, you may not have to, you know, the dreaded maybe labs or going to the doctor every day, every week, whatever your situation is. But there's really no turning back. Being active, whatever it is numero uno. Okay. With the exception of treatment, you know, so whether this is during treatment or if this is post treatment, okay. Um, the patient experience is really different because we're all so very different how we move about. I've met people who are like, oh, my treatment is tough. If I could, I would do some exercise. Okay. Sometimes it's not getting in a gym and picking up weights. Exercise can be simple as walking and stretching. You gotta do it. You know, like depending on your doctor, like sometimes they don't really give like a whole, I guess, a plan of your treatment. It's usually the doctors look at trying to save you. So right, you know, rightfully so, they'll think of the meds and the stuff that the regimen that you'll have to take. Sometimes you have to push, which I have done, because all of this wasn't given to me on a platter. You know, sometimes you have to ask, can I have a piece of the bread and some butter, you know, along with the meal? So you have to ask for certain things, like a dietitian doctor. Okay, should I be active with exercise? And most of the time they're going to say yes, but sometimes all of this isn't provided to you. They're thinking keeping you alive, and this is the medication aspect of it. Being active is imperative. It really is imperative because this is a bone marrow disease, right? So our bones are going to be affected. So any way that we can kind of help relieve some of the pressure, no one says you have to like jump off a trampoline and all of that, okay? But simple walking, that's something that I stress with my business. Just walking and just doing things in moderation. And depending on the individual, if you want to up it a little bit, along with your treatment plan, or if you're post treatment, you can't just, I don't know. Again, everybody is different, but for me, I can't just like, oh, yeah, my bones hurt, my hip hurts, and yeah, let me go watch some TV and try to get over this. Again, everyone is different, but if my bone and my hip is hurting again the next day, then that's telling me I need to like do a little stretching to try to help relieve what I have going on. It can't just be a continual unpleasant pain. I would say my biggest advice would be to just breathe. Take it in. This is the battle that I have in front of me. However, don't let the battle dictate how you want the rest of your life to go. Don't look at the burden as this whole thing now that disrupts your life. It does disrupt it, but it doesn't mean you can't travel. It doesn't mean you can't have fun. It doesn't mean you can't go to the movies. You can still do things, okay? It doesn't mean you have to stop dancing or whatever stuff that you did as a hobby or whatever. It's just something extra. So just breathe it through, go through the emotions, okay? Everyone's emotions are so different. And get to that point where you're ready to fight, because it is a fight like no other. I just like to stress being vocal with your doctor. Yeah, I've met plenty of patients, and there's just a different mindset sometimes of trusting your doctor as you want a doctor who you can trust. There's like a difference. Trusting your doctor, and do I feel comfortable trusting what it is you're saying? And some people don't delve deep into that. They kind of just go with the flow. So I met some people who are like, okay, I listen to whatever my doctor says, and I have to trust that they know what they're saying. Even though they may sit there with questions, but they're not vocal with the communication with patient and doctor. That tends to be problematic. To learn to just be vocal and don't hold it in. And that's another thing. Sometimes I'll see things and the questions are, well, what does this mean when so-and-so? It's just like odd questions that you would ask, I guess, strangers when you had your doctor available to kind of ask certain questions.